As a country, we have been overly reliant on aid. There are very many sectors like the health sector, education, especially around social services, where the government had left its obligations for external donors. Things like healthcare, they've been heavily funded by external people like the US, the EU, but now they have been slowly withdrawing their funding. And there has been a gap that has been created. As you saw from the issue paper, people have lost their jobs, people don't have access to health care, especially around HIV, ARVs, things like family planning, commodities that are needed by women to control their fertility are no longer available because that money has been cut off from the US, but also from donors from the Europe. So what we wanted is for the government to take stock that our social services are going to suffer. Our social services like education, like health are going to suffer greatly. So they need to step up. We need a plan from the Ministry of Health, how they are going to cover that gap. How are they going to ensure that people continue receiving ARVs, that even things like orienting the public on family planning, orienting the public on HIV, which have been traditionally covered by donors, can now be covered by the government, because for them they are more interested in funding things like military, funding elections, political parties, other than making sure that people have access to social services.